the logo, particularly in the logo, it is written that Ayurvedo Amrutanam. If I shall say that Amrutanam, Amruta is Amrut, and Amruta school is Ayurveda. We shall say in this way, so it will not be. First of all, I welcome to all. I must remember all my gurus. Ajnana timirandasya jnananjana shalakaya chakshuhu militam yena tasmai shri gurubhyo namah. You people are already guru here. You are teaching particularly this Panchakarma subject in your school, and hence we must discuss all these things, because I am practitioner. Since last 28 years I am practicing at Jalgaon, which is in Maharashtra. I did my post graduation from Jamnagar, from the department of Shalya basically, and I got 11 awards in Panchakarma. And just now I am putting my servicing under the Rashtriya Ayurveda Guru. As a Rashtriya Ayurveda Guru I am, and through this all the people I am just putting my views with you. We shall discuss with you so far as the Rakta Moksha is concerned. Already Dr. Santosh in the morning session has cleared everything so far as the Pitta as well as the Rakta is concerned. Very clearly he mentioned. So no need to again put all these things through these slides. We shall focus over the Rakta Moksha. When we are thinking, there are two words. One is Rakta and another is Moksha. When we are thinking about the Rakta, no. So, Prasanna Varnendriyam Indriyan. With the help of Rakta only, we got the Prasanna Varna. And Prasanna Tva Sukhanvitam Pushti Balopavannam Vishuddha Raktam Purusham Vatan. Hence, the importance of blood is there in our life. Simultaneously, some dosha, Susruta has clearly mentioned that Rakta is also one of the dosha, and we have to eliminate that dosha from the body. Hence, Rakta Moksha comes under the Panchakarma, that is Shodhana Prakriya. The character of pure blood, the pure blood is characterized by the Prasanna Varna, Prasanna Indriya, energetic organs, and then undisturbed Jataragni, regularized natural urges, charmful, peace, strength and good feelings. The pure blood gives strength, pleasure, complexions and healthy long life to the body. That is considered as Jivanam. Raktam Jiva iti sthiti. Right? This is actually all you people know very well. I am here just going to show you some slides as well as some clips where the Rakta Moksha can be advocated, can be done, and we are getting the wonderful results. Suppose some conditions are there in the morning, Madam has very clearly, sometimes we should not follow the Snehana Svedana sometimes, and directly we may go for the Shodhana Prakriya, because Susrita has already advocated such things. So two words are there, Rakta and Mokshana. Okay. More than 90% of the country even today could not get any encouragement so far as the Ayurvedic science. There cannot be any progress unless and until the faculties for the higher study along with newer techniques are awaited without leaving any principles of own science and that. And I have developed one method so far as the Rakta Moksha is concerned. I shall discuss it later on. Rakta Pradosha Hetu, previously Dr. Santosh has very clearly mentioned but if we shall summarize it, the Ahara Hetu, dietary factors are there: Ushna, Katu Sevana, green vegetables, stuff and Drava Ahar. Then the Tikshna, rotten food, excess use of Kulatha and Sura Saurika. Dushta, mash तथा जलज and anupa animals meat. These are also the one of the factor. So far as the rakta pradosha the vyadhis are concerned. Then the tila, curds and all these things, atilavana, potato, atiguru and sleep the stuffs. This is completely theoretical one, all of you know well. Still, I am just rapidly go through this chapter. Then vihara detu, excessive use of hot sun rays and fever. Day sleepiness, diva swap tatra, excess fasting, hard work, then suppress of urge for emitting, traumatic condition and sleeping just after the meal, excess traveling. That is also one of the cause. Then manasik hetus are also there. Excessive irritation, weeping, then excessive anxiety, then excess anger, even that is raga. That is also one of the cause of rakta dushti. We must consider all these things. So far the indication of the rakta pradosha vikara, almost the acharya have mentioned everything. If the disease not respond to any other type of the medicine or the measures, shall have to be considered as due to the rakta pradosha, the rakta dushti. Right? So in that condition we can go further directly for the rakta moksha. So what are the types of rakta mokshans are there? If we are classified it rakta mokshana with the shastra, the Sira Veda, Prachana and Suchi Veda, 3 types with the help of shastra, and with the help of Anushastra, Jalokacharan and the Vigarshan. Jalokacharan for the Anushastra and Vigarshan with the help of, can you say? Kharapatra, but which Kharapatra? Parijataka as well as Goji Patra. Have you seen Goji Patra? Have you seen the surface particularly? Here I found just in the last week that Goji Patra. Yes, that is Gojiva. The Latin name of particularly this Gojiva is Onosma bractet. You feel here, you will find the Goji Patra. Generally what happened, what we learn now, it was Slikta Patra, Goji. And you will not find the Khara Patra. You just observe it. Generally, actually this medicine you will get in the Himalaya only. But in Jalgaon, in last week, I got it towards the ponds. So we must learn these things. What exactly Goji Patra? Shefalika Patra everybody knows. But so far as the Goji, since last 20 years I used to find this Goji Patra where the Khara Patra, which is having Khara Patra really. So this is the Khara Patra, that is Khara Patri or the Goji Patra, Goji Huma. Another Rakta Mokshan by Yantra is Shrunga, then Alabu, Ghati, as well as newly invented method, that is the Gujarathi syringing method. This is very wonderful technique of Gujarati syringing method. 15 years back, I got the patient and he was reluctant to go for the leech application. Doctor, you do anything without this leech application. I shall not touch this leech because he knows well that sometimes I may suffer from the AIDS and any other disorders, viral disorders like that. And he was quite reluctant. So immediately I clicked. I saw one syringe and I cut it, the top of particularly that syringe, and piston has given put it from the another side. Just go for the prachana and put the syringe in that way. I shall show you, and go for pull the piston, so you will get the wonderful rakta moksha. This is wonderful one and unique technique. You can apply in your practice, in your clinic, even in the camp procedure. You can do this, so that immediately you can get the relieving of the pain from the particular that affected part of the body. This is wonderful one, and that is the choice of Shrunga as well as the Alabu. Because in both Shrunga and Alabu, creation of vacuum is there only. There is no role of Ushna and Tikshna and Madhu, I don't think. Simply the creation of vacuum is there. The same thing is there. I shall discuss everything accordingly. Classification of Rakta Mokshan we have seen. See, the middle one round types of Rakta Mokshan, that is we have already seen Yantra, with Shastra and Anushastra. The second round, that is in Yantra, Shrunga and Alabu, right? And in the Shastra, Siraveda as well as the Prachana. And the Vigarshan Chikitsa, that is in Anushastra, that is Goji Patra as well as Shefalika Patra as well as the Jaloka, right? And the another next one, the next round is which indicates the Vata. The Shrunga is indicated for the Vata, then Alabu for the Kapha, then Siraved, which is not, it is actually Sarvadehika, and the Prachana is also there, and Goji Shefalika Patra is, that is for the Pitta, and Jaloka is also for the Pitta. And another round here, you just observe it, which indicate that the level of involvement of vitiated Rakta, what sort of the Rakta has vitiated. It is indicated in Ashtanga Hrudaya. What? The Avagadaram, then Sarvadehika, Tatha, Sukumaratvam. All this indicated under the indications of basis of visibility of application. Where should we apply particularly all these yantras as well as Anushastra, these types of Rakta Mokshan. Here this chart shows the contraindications of Rakta Mokshan. The patient, basically when we are doing the practice now, you should know what are the contraindications first of all, in spite of the indications. Where to do and where not to do. Where not to do, that plays very important role in your private practice. In your institution, okay, that all. But in the private practice, it is not allowed. So, very clearly, the patient who are having swelling all over the body, that is Shodha, right? Those bodies take weak due to disease, who is suffering from Pandu or Arsha, then Udara and Kamala, owing to excessive consumption of Amlasar, etc., are contraindicated for the Rakta Mokshan. It says hemorrhage. If hemorrhage is there, you should not go for the Rakta Mokshan. So these are the charts, no need to go in the details, because 90 disorders are there, as well as some authors have indicated where, suppose the Ambavata is there, which is indicated in the Siraveda, this Susruta has indicated the Siraveda, as well as in the Daha, Charak as well as Susruta indicated for Siraveda, and sometimes you may use the Jaloka also. So in this way, you can conceal all these things. You shall discuss the detailed description of types of Rakta Mokshan theoretically as well as the practically later on. Right? Now we are thinking about the Siraveda. Siraveda, Chikitsardham, Shalyadandra, Pakilya. So Siraveda, shall I go in details of Siraveda? Practical aspect. Yes, we shall do the practical on the first floor. No? What are the Avedya Siras? That is also important one while we are doing the practice now. Which are the Avedya Siras? All Siras I shall give you through the this PPT. You will come to know everything. Prachana, Panchakarma, Pradhan Karma of Siraved, then the vein should be duly opened or pierced with the help of proper instrument. First of all, you may go with the 18 number needles or 16 number needles, and with the help of this needle, you can perform this Siraved. we are doing the any sort of the Rakta motion, so it is the indication is Agre Sarvati Dushtasam Kusumba Eva Idika. So first of all, blood will come the Dushta only. That is the clear cut indication. Yantram Vimucha Murchayam Vijite Vedanai Puna Sravet Murchayam Punastasya Trahed Api Va. If it was not properly, again you may go for. Right? The importance of blood letting. Dushta Rakta Apagamnat Sadyo Rog Rujam Shama. Immediately, first of all, that Ruja will subside with the help of Rakta motion. You must be a good blood extractor. You should know all the principles, all the disciplines of Rakta motion. Without knowing the disciplines of Rakta motion, you can't perform. See, in the jugular vein also you can perform. Just Doctor, what is your good name? Patil. Patil has told me. The Prachan, simply, we shall. Is there patient for Prachan, Dr. Namudri? Prachan. Is there patient for Prachan Karma?
Volunteer.
Prachan, no? Okay. We shall.
One volunteer.
You may come, any volunteer if you there. In my practice, in spite of putting the scalpel, you just take the simple blade, right? And you can do with because which is having the wonderful edges, and that is very sharp one, so that you will not just putting the pressure over the skin. No, superficially you can make the prachan with the help of, and I am using this blade only. This is you have seen Gojuma, this Gojuma, Gojipatra, and the khara part. We should take it and rub it. Anulom. Another is Shephalikapatra, that all of you know well. There are 12 types indicated in the text, but when we are practicing, only the thing we are not come to the conclusion that whether it is Gorochana, Krishna, Karbura, Alagada, what we can't identify well. But simply just see with the naked eyes and with the help of sparsha only. If there is thara sparsha, we try to avoid such a leeches. If it is snigdha, plainly, you can use it. Right? The properties of types of jaloka. Nirvisha jaloka, color like that of moss. Then rounded bodies having a bluish lines on the body. Then color dorsally like that of herbal decoction and yellowish color ventrally. Then in the service jaloka, color like the earth, too long, you will get a too long, then slimming, thick at the centers, slow movement and slow swimmingness, and not useful for the medical person, such service jaloka. The types of jaloka, it is mentioned somewhere that Sukumara, Tanutvaka, then Alpa Shiraksha, then Bruhad Dhara. This is Stri and Purusha. Right? The indication of particularly jaloka is Jalokastu Sukhinam Rakta Sravaya Yojaya. The person who is not having good sattva, you may use this jaloka only in such occasion. Some people are doing this type of the practice, but this is wrong. What are the wrong here in this picture? Can you tell me?
Distance of applying kilo.
Another already picked. Yes, leading is there. Another, the basic is the part has not shaved. The basic. If you are applying the leeches now, so it will take more than 2-3 hours. The simple technique I shall show you. In the case of Vatarakta, you can apply the leeches. Because there is the Pitta. As well as in the Agni Visarpa, only Jaloka is to be applied. Plain Jaloka. No other remedies are there. No other types of Rakta motion should be advocated. See, in the Agni Tushta Agni Visarpa, you should not use it. Another method is that is Shrunga. Have you seen in your life? This is Shrunga. Many people in many colleges, you will not find this Shrunga. And hence, I am coming along with this Shrunga. Anybody want to see? This is Alabu. So in Shrunga, you have to also go for the first of all the Prachana. Then you apply the Shrunga and you have to suck it. So this is crude method. You know? The principle, what is the principle? That is the creation of the vacuum. The same thing is there in the Alabu. This is Alabu. Right? In Alabu also you have to go for the Prachana. Put one coil and burn and keep it in this way. So which will create the vacuum with the help. And finally very few blood is coming out practically. In spite of all these things, if we shall go now, that is syringing method. It is not right. This is rubber. It is not right. See, this 2 cc, 5 cc or 10 cc or 50 cc syringe you can take. Cut the top of particularly that syringe. Take the piston and insert it through this part in this way. Put the Prachan, just come. Shall show you.
और क्या
सच में ही काटना होता है.
जाओ, कुछ नहीं होता, जाओ शर्मा, छोटे शर्मा.
हाँ सर को कुछ नहीं होने वाला है. पहली बात तो when you are doing the Panchakarma, no, first of all you should know patient मर नहीं रहा है. Do it.
बैठो साहब, बैठो.
Within 2 minutes, no? And again, what the Shastra says, Avagada, Avagadattara and Avagadatam. What Avagada is there? You can visualize with the help of this method only. Otherwise also it is not clotted one, no? The clotting time is 5 minutes, 5 to 10 minutes, 7 minutes. Whereas you are getting this blood, that too within 2 minutes. That is clotted like you can see like the avga. What I want to show you these things. Shastra is there, but we are not practicing well. We are not come to know what is avgada. Nobody knows. What is pindita? We don't know. Isn't it? So this is the thing.
So that question that how much it should be
10 ml, 20 ml, what the areas have affected. If the shula is removed, you can take out this procedure. Very simple. Another one method is there. This is suchi. Many people from Maharashtra is there. They might have knowing this suchi. This is insulin needle. And there is reference of suchi in Charaka. Vatrakta as well as in Arsha. Jalaukavi tatha shastrahi suchi nirva punapuna. This suchi. मैडम आओ अभी आना पड़ेगा डोंट वरी आपको हेडेक हुआ है ना आया ना नहीं हुआ तो फिर आपको करना पड़ेगा तो
जाओ घर से बहुत बात है ना तो मजे ले रहे
क्या लूडो का मदर भाई why you are afraid
She's ready. She's coming now.
this is why I am doing this suchi with the lady Sukumar
Yeah. Main point.
do come here so that everyone will see. If you are getting the severe pain in abdomen even, just simply nothing will do. See? कुछ नहीं होगा अरे कुछ नहीं होगा हम लोग ऐसा करेंगे तो पेशेंट पे क्या करेंगे सपोज हियर पेन इज देयर दिस एरिया nothing else and as blood has come do you get the pain little no yes see this is vata tanu krishna arunavarana right so there must be paining with you in the body 100% yes or no chal bhai don't worry let them come out it will stop automatically don't worry right
दूषित है
no अभी लोग आप लोगों ने यहाँ से सीख के जाना है
Sir, ये
सभी लोग बैठो सेटिंग पर है ना
no need हाँ यस पेशेंट को करने का नो नीड तो हमने डॉक्टर भी बोला नो नीड टू गो फॉर ड्रेसिंग क्योंकि सच कॉन्फिडेंस मस्ट बी डेवलप विथ यू फर्स्ट ऑफ ऑल अदरवाइज यू आर अनेबल टू डू ऑल दिस प्रोसीजर्स राइट
Sir, this suchi is to be given on Mausala Pradesh or any,
even on the in the bony area also
but it has to be inserted.
inserted in not in deep just I shall show you come here if questions are there no
Yes. Not my original.
नहीं सर चलता रहेगा
I shall do the I shall do the demonstration on the even patient no problem just you come along with the jalogan now
उनका सिखाने का चल ऐसे ही है सर
हाँ yes वो हमको वैसा practically because we are practicing we are no it does not mean that I am not knowing everything but simultaneously what is my role here to encourage you.
Yes.
The new peoples are there.
Teachers.
And everybody should know. 10 years back, I gave this lecture at Jamnagar, and out of 55 teachers, 45 doesn't see this procedure, all procedures. They did all the procedures at Jamnagar, and they free. When we are a teacher now, we should know everything, at least. There should not be any fear with the teacher. Otherwise, what the student will learn? Nothing.
चलो सर नेक्स्ट
आइए
Look,
ऐसे उधर सर तो बैठो आराम से
बैठो भाई बैठो
see. In the Netra Roga, that हो रहा है ना, you come here, very nice, very gentleman. You are big and for this person. Yes. लेकिन सही बोलने का जो भी होगा वो. Otherwise नहीं ठीक हो रहा है, ऐसा नहीं होगा. See, इनका सही में दर्द हो रहा है. That this is the indication. ये जो वेन है ना, यहाँ पे फूला हुआ. Yes, prominent. Oh, see, slowly.
Please, all of you please sit down.
Madam, you come here. You observe this vein.
नजर आ रहा है सर.
Right?
We can see.
हाँ, yes. हाँ.
पीछे आ जाओ.
नहीं, सीखना हमको यही है.
नहीं वो टच कर.
बाकी तो किताबों में सब कुछ लाए, उसको मैं बताने से कोई मतलब नहीं, बहुत सारा. क्योंकि otherwise it will take 2-3 days
सब प्रिंटेड है.
to elaborate all these things. हाँ, yes, इस साइड में होगा. Yes, right. Okay. जहाँ पे हो रहा वहीं पे होना था बाबा. See, just
only surface पे.
सरफेस नहीं, थोड़ा सरफेस के अंदर डीप में जाना है. देखो, सी
No more and nothing ना.
वेट से लगाया ना
on the vein. See,
हाँ.
nothing will happen. हाँ, पढ़ू दे. काही होत नाही, आपण धुंड टाकू.
ये कौन सा दूषित है या दूषित है?
अरे जो भी है, पेन कम हो गया तो समझेगा ना. No, I am not going to praise it. Just simply swab it. Nothing. हाँ, yes, होने दो. ये सब होगा. ये ऐसा कुछ नहीं होगा तो कुछ नहीं सीखेंगे तुम. If the allopathic doctor do these things, and you are getting the homeopathic, they did all right. And why the Ayurveda not? Because already otherwise also it will subside within 1 hour. Yes, directly. नहीं, आपको मत देखो, आपको मिलेगा ना देखने को, वीडियो निकाला है ना हमने. अभी आप दबा कर, नाउ इट इज ओवर ना, नाउ यू कैन पुट द पेशेंट. वैसे दबा कर. अभी सही में बोलने का, आपका दर्द कम हुआ है या नहीं है, नहीं है तो नहीं बोलने का, आया तो आ बोलने, नो प्रॉब्लम. 10% है रिलीज. This is otherwise also Siraveda is a partial treatment. It is not a complete treatment. Siraveda चिकित्सा अर्ध चिकित्सा है. नहीं कुछ नहीं होगा, मैं आपको देता हूँ, गोली देता हूँ उनको. So you should keep all these things with you. वेन में ही था ना, तभी तो आएगा ना. वेन में नहीं होगा तो नहीं आएगा. हमको वो प्रोमिनेंट दिख रहा है वेन वहाँ. सो डू दैट प्रोसीजर. सिरा वेद करना है ना. Either you may go with the Vrihimukha or the Kuthalika, but it is not practical in practice. If you are putting the Kuthalika now, the patient will go out in your hand. Right? So these are the simple methods. You have seen already this Gujarati syringing method. With the help of disposable scalpel sterile scalping, you can go for the CeraVed with the help of this disposable scalp needle. The indication of particularly the sarvajayika rakta pradosha vyadhi, you can perform this CeraVed by the either cubital vein or nearest part of the particularly affected part. From anywhere you can go for it. Only the thing you should know the marmas even. Sira marma. If you are not knowing the sira marma, you will get the complications. Another is, so far as the syringing method is concerned, you have to go for the prachana and then you apply, right? So what are the benefits? The Gujarati cinema can be applied in children even, because he is not knowing anything, and in pregnant lady also, right? If the conditions are there. Gati is not practicable. You have seen here 8 methods. Can anybody tell me 8 methods? Complete all types of Rakta motion. First of all, very closely we shall go line up. No, one first is Vigarshana. Vigarshana with the help of Goji Patra as well as Shephalika. Another is Prachana. Then Siraveda. Then Shrunga, Alabu, Gati Yantra, Jalokavacharan and Suchi Veda. This 8 method we have described. And everybody can practice in this way. This is the Rakta motion is not that critical one basically. But nobody is doing. And the simple method is that is the GS method as well as the Jaloka Charan. You can apply the Jaloka, Siraved and the GS method in your private practice. These are the 3 options are there with you. As well as 4th is the Suchived. It is wonderful procedure in the camp. Because in the camp, n number of the patients you are getting with the pain only. And that pain can be relieved by Suchived only. Immediate. Anywhere. Either in the any inflammatory conditions, in Janu Shul, Kushta Shul, or in the Udara Shul also. Even in the renal colic, you can do this procedure, no? So at least you must assure that pain has come.
Appendicitis.
Yes, in the appendicitis also.
For renal colic, which side, sir?
Huh?
Renal colic, the side is?
Yeah, the pain is there now. You have to choose yourself. Huh? In the painful condition in Sandhivata, Vatrakta, Proshtuk Shirsha, Amavata, Vatrakta and inflammatory condition of even the Netra. I shall show you the clips. One another condition is there, that is very critical one. Listen carefully. That is trigeminal neuralgia. Trigeminal neuralgic pain is there. What you will do? No good remedy is there in the market. The trigeminal in the neuralgic condition, you may go for to apply the leeches. First of all, you have to clean the leeches, prepare the leeches. Yeah. Your pain is there, no? So directly, yes. Himself, he is a doctor. He is DHO at Jalgaon. He got the pain, severe pain.
Sir, you
It is taken the light inside.
Yeah.
Sir, how many days the pain relief is painkiller and active?
You will get the relief at least for 5 to 6 days. And thereafter, you should go for the another treatment. This is not the complete treatment. Each application is not the complete treatment. But severe pain can relieve within an hour.
Sir, so in which condition it was given?
Paining condition, no? Severe pain.
Trigeminal neuralgia.
Trigeminal neuralgia, no?
Yes.
Sir, will you reuse this?
Yes, we shall be used after 7 days. Yes, in the same patient. Even in the another patient, no problem.
So where is the bite on this patient?
See, you just observe now.
Sir, this is a patient now?
Trigeminal neuralgia.
आशाराम को चाहिए सर?
हाँ?
आशाराम को चाहिए?
आशाराम क्या?
आपको आशाराम
वो आए तो अपन करेंगे ना, उसमें क्या देंगे?
उनको कोई और जगह पर चाहिए
Why then apply it? Why not gums, sir? Why not externally? Because
Actually, pain is there on the tooth inside patient.
because
Sometimes it is here. I shall show you. That is also that condition also. That in that condition you can apply here.
So wherever
Upon
the patient feels
feel more pain.
that's
Yes,
not
that
the
point
doctor.
is to be selected. That point is to be selected.
गम्स के ऊपर लगाने का ना
Yes, गम के ऊपर लगाना.
And suppose sir, pain is radiatory, just like in trigeminal neuralgia, when there is one half of the face there is a pain.
Yes, you have to select the maximum pain. Where is the maximum pain?
Equal distribution of the pain.
Yes.
Then we can apply anywhere.
Yeah. See, it is filled. And fortunately, this doctor belongs to Ayurveda. He is DHO at Jalgaon, district health officer. See, immediately thereafter you can take the interview and the patient. You should keep all the records with you. Squeeze the leeches. This is vacha powder, Acorus calamus powder. You have to squeeze it very gently.
मैडम कैन यू जेंटली
Yes, it is in Marathi. You can observe his face.
ये माइक लगाओ माइक पुट इन योर लैपटॉप
माइक नियर लैपटॉप मधु
all of you must keep all the records with you. Otherwise, nobody will believe you. Kamil Ajala means has released. In a parsing rule, you can go further. GS method. She is my Mrs.
Oh, it is control on the message.
तो इंटरव्यू में थोड़ा सा वो लगेगा।
Home Minister.
हाँ यस होम मिनिस्टर। ऐसा नहीं कि खाली पेशेंट के ऊपर करना चाहिए, है ना? अपने घर में भी है तो अपने घर पे भी करना चाहिए। मालूम है कि
दर्द करने का मौका मिलता है।
दिमाग अलग ही चले गए।
अभी किस पे एक्सपेरिमेंट करेगा पता चला हमें।
What do you want? Another case of trigeminal neuralgia. This is the right method. You are having already the syringe, no? You put this syringe on expected part where you want to do this procedure and release this leech through the another part. Very simple. This is not indicated in text, but that yukti is with you and it must be.
नहीं ऊपर से नजर आ रही है।
So now in Jalgaon, if the trigeminal neuralgia is there, send to Dr. Narendra. Very simple.
Genius method, sir.
So we have to be very careful, otherwise if the patient has, it can go inside also.
It will not go inside. It will not allow you. Chhardi will be there.
Yeah.
100%.
Experience.
Okay, I shall show you. Otherwise, if the leeches will be there. That is the star method. This syringing method is useful in the paining condition as well as in the itching condition.
इसका वीडियो है कोई?
हाँ यस, अभी तो वीडियो बहुत सारे हैं, हम लोग दिखाएंगे भी आपको। लेकिन हमको जो सीखना है ना, वो मैं तो आई एम जस्ट टैकलिंग critical conditions. And in critical, in the morning, we have discussed the virechan and everything. And so far as the urdhvaga virechan, urdhvaga raktapitta, we have to go for the virechan only. But in the ICU, patient is suppose in ICU. And one patient I got 2 years back on the day of Dhanvantari Utsav. She is 18-year-old and she got the profuse bleeding from mouth, projectile vomiting, about 5 to 6 fits in projectile, and she went in coma. And after the infusion of 8 bags blood as well as the platelets, they have declared that patient, you may take this patient at home, no remedies are with us. So this is the condition of urdhvaga raktapitta. Already she was on ventilator, RT was there, then what such a violation we will perform? This condition is not there. I am just putting this case for you only. If I shall get right? Yes. This is one pattern. Another is Dhupanandra. We are having a very good literature so far as the Dhupan is concerned in our text, but application is not there in private practice, nor in private practice, even in the institution. Nobody is doing the Dhupan. Why? Because it is not easy procedure to make the Dhupan. And another third one is, that is, this is a very wonderful one. Nano Niruha gel. Nano Niruha gel. You are having the problem, no? While you are giving the Niruha, no? So in the morning, neither the doctors used to come in the hospital by 6 o'clock, nor the patient. And if you are providing everything with the patient, sometimes what will happen? That decoction will burn many times. This is converted into the gel form. The decoction as well as the kalka, madhu, lavana and taila. Completely. This is just a 20 cc in gel form. And I am going to take this patent of particularly the formation of gel, not the medicine. What is the procedure of preparing the gel? I have put it in, and it is under process of examination in the patent. Just in the 20 cc you will get the whole. And what is the another benefit? If you will mix it now in the water, what you expect, either 1000 or 700 or 500 like that, whatever. Yes. You just stir it well. You will not find the layers of kalka as well as the kwatha and the taila and nothing. Which is homogeneous mixture. See. You can smell it.
So which company, which vessel?
Which drug?
Yes.
I shall not disclose. Because it is under process.
Sir,
No, we are not asking for the formulation how to prepare.
Then?
What was the kashaya?
It is, yes, it is a rasayana nirvaja. Rasayana. And rasayana is simply
We
the
can also
amalaki.
put that in microscope.
Simply amalaki, dhatri.
Yesterday you prepared slides, no? Was the preparation. We can see this also under the
No, yes.
अरे लंच कर रहे हैं हम लोग.
sir,
We are enjoying the lunch.
चल रहा बढ़िया चल रहा.
sir, sir, any preservative?
Very right question. Yeah, ask me. It was expected. No need of preservative. Why? Lavana itself is preservative as well as the madhu itself is preservative.
Sir, how long will it?
For 1 year. You can keep it for 1 year.
Sir,
And oil is also preservative one.
Yes.
You are eating pickle, no?
oil.
So yes, I will there.
थोड़ा बहुत तो separate होगा ही।
After after
Soon after this,
हाँ,
or we
yes.
just leave it.
अब जैसे से फिट करोगे ऐसे से सब separate हो जाएगा।
And if you want to add the oil no more, you can previously add with the gel, then put it in.
Sir, but I mean, even if you implemented the similar procedure like in a pickle, after some time because of moisture and
Yes, after some time no. Yes.
If oil
It doesn't contain water percentage. Listen.
Never.
It doesn't contain water percentage.
Then it's
At home we can keep a jar for years.
So what is the cost coming
Because
here?
oil on it.
This 20 ml for 200 rupees. I am supplying that to the patient for 200. One sachet.
And it is valid for two
1 year. No, one for one basti only.
one must be 200 rupees.
You can make 10.
Yes.
If you want to earn, you can make 10. What will the problem?
Effective is how we
Effective
or one whole. And 1,000 1 liter.
1 liter or 750, 700. Actually, previously it was indicated 1 liter, 960, no? Right? 960. But that time, previously, what was the weight of that person? It is more than 150 kg. Now we are just 50 and 60 kg. No need to put such a amount of basti. What is the another benefit of particular? Just tell.
sir, is the gomutra in
Yes, I am showing you.
gomutra और नीम पता ही है
एक सेकंड पहले सर
Add more water. There are two holes. One is outlet and another is inlet. You may take the position. Left hand. So patient, you advise to the patient, please lie down on the left lateral position. Put this bottle, this reservoir in front of the chest and insert this nozzle through the rectum. Right? First of all, you should eliminate the air, vata dosha. Right? Upon his arrest. You just pump yourself. It will slowly. This is the mechanism of principles of physics, nothing else. Right? Get it? This is very simple. I just used to provide all these things with the patient. I am taking 7,000 rupees at a time. You will do this procedure 1 month with this. Very simple.
अच्छा इससे वो खुद लेते हैं।
Now question may arise with you, how it will come. The air pressure is putting over the surface of the drug this air pressure, which leads to even there is even in the without gravitation force also you can do. If the Basti yantra is here, no need. Get my point? So this is the patent. This is patent type. Now another yantra, that is Dupan. Simple pipe is there. This is manual one. If you attach this machine, it will become auto. Just start the button, it will create the pressure over the surface of the drug. Right? Yes. पता लगता है ना? I shall show you first of all Dupan.
Will you say
Yeah,
how much it will cost?
1,200.
Auto.
Not this one. Auto 2,000. IPR, under IPR. Intellectual property rights. It is called intellectual property. You have to place the worthy of what you choose your drug. This is hollow worthy. You place it here. Another cap from the another end. And we all are having wonderful brain. We have to utilize it in our through the patent only. Right? So what are the benefits? At anywhere, you can go for the Vastra Dupan, you can go for the Yoni Dupana, you can go for the Arsha Dupana, Vrana Dupana, everything.
And after 1 month.
Yes, you can inhale even for Dhumapan also. Just take it out
सब कुछ आइडिया है
and
वाओ
Sir, one more time.
so we have to innovate some yantras, and hence Sushruta says ekam shastram adhiyano na vidyat shastram tasmat bahusrutam iti. Physics, chemistry, whatever sciences are there on the earth, you must utilize in Ayurveda in this way, and you are having wonderful brain than that of me. So I expect from you people also to go for the patent, right? 1,200. एक ही प्राइस रखा है सबका, ध्यान में रखने के लिए अच्छा लगता है. वर्ती कौन सी? There is a reference in Ashtanga Hridaya, Vacha, Sikka, Bhugalu and Bhuta. Right? So, thank you very much. My experience with you and we shall discuss. Right?
So please give your contact number and address so that we can all.
Yes, yes. For the doctor, if today anybody will keep their, what you can say,
Order.
I shall put you discount 25%. for the doctor only. You may sell at any cost, no problem. Come in. No. That is, there is battery. It is battery operated.
But it should be very, only do one.
Yes, yes, yes.
Very useful, very safe also.
I am now going to the another innovation. If we shall get taking the effects of particularly all the drugs over the Clostridium tetani, so that the whole OT can be fumigated with this drug. If we are getting the good result for the Clostridium tetani, there is one organism, and if we shall get it, so because hazardous drugs are there, no, for the fumigation of OT, and this complete yantra will remain outside the OT, and complete OT will be fumigated by putting the tubing.
Can you apply the
Yes, yes, yes. But in the nebulizer, there is no connection of particularly keep this place this worthy.
air pressure?
For air pressure. Yes.
To the that
No. Like that nebulizer बोला था ना?
Thank you, sir. The session, it was very wonderful session. It was very amazing, inspiring, innovative.
Another attachment also there. This is direct. This is spread one, jet one, and this is directly you can
You can use for kernel.
yes. On the wound and dead sores, diabetic wound can be healed very fast.
and that gel you have prepared for one that Gujarathi or other basti also.
Other basti also.
All
Icha basti, then Vatakna basti,
All
this
other.
rasayan, yeah.
200%. Rate तो same ही रखा है.
25% I did,
What
so
discount है?
25%
तो
discount.
10 days छुट्टे के गवर्नमेंट और सीपी से मैं कर रहा हूँ.
तो जामा ज़्यादा मिलेगा.
Actually, when we are practicing now, it is very difficult to
एक और
make all these things. And maximum, I am running the critical cases. And in the critical cases, we got very good success.
बताएं ये केस, admitted केस.
हाँ, ये
ICU,
हाँ, वो
ICU.
ICU वाला ना, वो देख रहा था।
वीडियो में दिखाइए तो बता दीजिए क्या हुआ.
नहीं, आया PPT में।
ये ठीक है.
हाँ वो दिखाई.
Now it's the time to honor Dr. Narendra Gujarathi. I invite Dr. K.P. Nambudri onto the dais to honor Dr. Narendra Gujarathi. Sir, please to be on the dais. I think it's very good to give a standing applause to him at this time of honoring.